Hi, everyone. Welcome to Purple Coach Conversations with Tanya and myself, Anne. Our goal is to normalize, educate, and inspire conversations around diversity and inclusion. We are both coaches, mothers, and entrepreneurs. And while we are not experts in diversity and inclusion, we want to have conversations with people that have something interesting and unique to say about diversity, inclusion, and also their journeys and their lived experiences around this. So today we are joined by Dawn, and I'm going to let Tanya introduce her.
Thank you, and thanks so much for joining us, Dawn.
Thank you.
We'll let you introduce yourself very, very shortly. Dawn is a registered mental health nurse. She's been working for the NHS. She's been for 27 years working as a registered mental health nurse in hospitals, community for older adults and younger generations as well, and in acute mental health and community. And she's a qualified coach since 2018 and NLP master practitioner. Thank you, Dawn, again for joining us today. And we would love to hear more about, your story and how you got to where you are today, what you've experienced up until today.
Okay, thank you for having me. As you know, my name's Dawn. I'm a mental health nurse. So give you a background about myself. So I'm the youngest of 5 siblings to parents who were born in Jamaica. So I've been born in the UK, so I've been here all my life. I've got 3 children, 2 grandchildren, and I used to do some volunteering in the community. I used to work for a charity in Wolverhampton, where I'm based, called the ACCI, which is the Afro-Caribbean Community Initiative. And that's a charity for Black Afro-Caribbean people who have experienced mental health issues. And they have a variety of day centres, accommodation, supported accommodation, independent living, and they have a carers team as well. So I sat on the board there for 12 years. So as you mentioned, currently I do work as a mental health nurse in NHS. I'm currently based in police custody at the moment. So my job is, when people get arrested, I assess them and I signpost them to the most appropriate service for their needs. So when I say people, that includes children from the age of 10 upwards. So we see it's an all-age service that we see. We predominantly focus on juveniles and females, because research shows that females have a lot of vulnerabilities, drug, alcohol, domestic violence. And we also see people in custody who have mental health markers like suicide, mental health, suicide markers. So my role is, as I said, when people get arrested, the custody sergeants will refer into our service, which is called liaison and diversion. I mean, liaison and diversion, it's been up and down the country in all areas now. You find mental health nurses in police stations. So we get the referrals and we assess that person, and then we see what their needs are. Sometimes it could be, I could write to their GP and say, well, can you prescribe this medication for them, or increase their medication, change it, review it, or they might need some form of counselling, some kind of therapy. So then I would refer to primary healthcare services like Healthy Mind if they need some low-level therapy, or if they need to see like a psychiatrist or something even more of a prolonged therapy, then I'd refer to secondary mental health services. If the person's got an acute mental illness, because a lot of people who come to custody can present with that, then I'd have to refer them for a mental health assessment, where they'll be assessed under the Mental Health Act and they can be detained. Or they might require more low-level intense support, like home treatment, which is another service we use to prevent people going to hospital, where they're treated at home, where the nurses will come and see them at home and deliver treatment and therapy. So it's quite a varied role, really, what we do. We also see people who come in for a voluntary interview. That means they're not under arrest, but they've come to the police station to be interviewed, still under caution, but they're not actually under arrest. So it's like come by appointment as well. So yeah, it's quite a very interesting, varied role what I do. Very, yeah. And
Yeah,
also,
really sounds like it. There's quite a
also as
lot of
well,
variety. Sorry, go on, Don.
so
Sorry,
I
go
say,
on.
yeah, so that's touching on the bit of my professional, my work. Yeah. Karen, ask a question.
I'm sorry to interrupt you there. I was just saying it's really fascinating as well, the range of people that do come into the police custody. Just for those who are not aware, what's the difference of coming in on a voluntary basis as opposed to being arrested? Is it someone who's just come in to kind of say, you know, I've committed X, Y, and Z crime, or because you say they're under caution?
Yeah, I mean, it depends. I suppose it depends on the level of the crime. Obviously, if someone's committed murder, then definitely they will be arrested and brought into custody. That's without a doubt. But sometimes what will happen is, like, say, perhaps a lot for juveniles as well. There might have been like caught shoplifting or something, and it wouldn't be in their best interest to arrest them, bring them to custody while they investigate that. So they'll arrange a time where they'll come to the station with a proper adult, which is normally a parent, and if they want legal representation, a solicitor, and then the police will interview them under caution still. So it's still under caution, but it's just not, they're not actually under arrest. They've come at an agreed appointment time. I mean, sometimes in the media you hear celebrities who've come to the police station with their solicitors at an agreed time for a voluntary interview, if that makes sense. Yeah.
Okay. The other thing as well we're quite aware of as a society, well, I think maybe people who are interested in this kind of topic and misrepresentation, that word, of Black people, either with a stop and search, being arrested, and so on. The last time we spoke as well, you mentioned about how it's about three times more Black people are diagnosed with mental health issues once they're taken into police custody. I think that figure, I mean, now, at least when I know that a lot of Black people are becoming more open about their mental health issues than previously. And, you know, from your experience as well and your expertise, is this just society representing itself how it's always been, or is there something deeper in why three times more Black people are three times more seen to have mental health issues once they're in police custody?
I mean, it's not in police custody, it's in general. I mean, that is well documented in research over the years that Black people are more likely to be diagnosed with severe injury and mental illness three times more than their white counterparts. So that's historical, that is, not just in police custody.
Yeah.
I think there's a lot of more variety of services now, as opposed to back in the day when I started training, it was just medication. That was what the focus was really. But like now, we tend to use more therapy type, because medication doesn't really suit everybody, and not everybody wants to take medication.
Mm-hmm.
So it's about, you know, working with that person as to what they feel they need. Obviously, there are some small amount of people who do need medication to keep them mentally well, and those people, you know, do end up getting them detained on the Mental Health Act and treated against their will because of the lack of insight into their mental illness, which has an impact on them and their family and the community. But we do have a lot of more therapy-based solutions now, really. And we do have more services, like ACC, like I mentioned, they do talking therapy, which is very culturally sensitive and diverse for the Black audience, because most mainstream services are not geared for that. It's just like a bog standard one cap fits everybody kind of thing. But when you come to therapy, you know, some people feel more comfortable talking to someone with the same background as themselves. But on the other hand, you do get some people who don't want to go to Black services because they feel like people are going to know their business, everyone's going to know about them, so they prefer to go to mainstream services. Yeah.
I'm really curious about that as well. Just looking at my own community of Black people or people of color, but I'll just stick onto the Black community just for a minute now. Is it, from your experience as well, working as a mental health nurse and in this industry, is the reason that it's now 3 times more because we have more mental health issues that we're going through at this, you know, this period where we're talking about the 3 times more? Or is it because that previously we were just misdiagnosed?
I think it's a bit of both, really. I think in my experience, in the years that I've been a nurse, I've met a lot of people who I believe have been misdiagnosed. And I think that's due to a cultural thing, because Black people on a whole, we tend to be quite loud and outgoing, and people can mistake that as, aggression and violence. We have particular like cultural things, like some people believing in ghosts, spiritual things like that, and that can be perceived, oh, they're deluded kind of thing, but that's a cultural thing, really.
Yes.
So I think there's been, over the years, people I've come across, I do feel have been misdiagnosed. And that's got to do with the perception of the psychiatrists who actually make those diagnoses.
I mean, this is such a complex topic that you're bringing, because it feels like there's different elements to it. There's, on the one hand, mental health. People have become more aware of mental health issue, and it's being anxious is a mental health issue as well, right? It's diagnosed as an issue. So it's more broad now. It's before it had to be, when you were delusional, etc. So you had a mental health problem, and then it was like you're saying, medication. And correct me if I'm wrong, but there's also the part where the professionals, like you're explaining now, so the doctors, the I'm sure your colleagues, etc., they're not aware of the diversity and the surroundings of the individual and where they come from, etc. And they might tick a box that is a wrong box about mental health, and again give them medication rather than trying to do the therapy approach. And it's all about an education. And I'm just wondering, you as a Black person in this world, where you a minority there, understanding this, understanding the individual as a whole rather than just putting that person in box. Did you feel sometimes you had to voice out loud things that you knew from your surrounding, your history, etc., that they didn't know, and you had to educate them? And how easy or hard was it to get to explain to your colleagues that maybe weren't familiar with the complexity of the individual?
Yeah, I mean, it takes me back to a time when I was a student nurse all these years ago, and when I was in a placement in an older adult ward, and every Friday doctors would have a teaching session with the junior doctors, and they'd present a patient and discuss that patient. And I went along once to this training, because the patient they were discussing was a lady that I was working with very closely on the ward. And the doctor was a junior doctor. It was an Asian doctor. And he presented this lady, and he was talking about, she was from Jamaica originally. She came here probably in her late 20s to be with her husband and had a family and so forth. She had I'm trying to remember what diagnosis. I think she had dementia, I think. So he's just explaining the background and how she came to be on the ward, and then he was talking about, he's met with her a few times, and she's got this delusion that she's got property in Jamaica. She owns a house and she's got all this land, and I felt very strongly about that, because my parents are from Jamaica, and a lot of people from Jamaica do have property and land. It's not like in this country where you have to be rich to have property and land. That's just the norm in Jamaica. You would have land, they have a house on their property. And I'm going to put my hand on saying, what makes you think that she's delusional by saying that she's got property in a house in Jamaica and land? And he goes, oh, well, there's no evidence of this. I said, not being funny, but that's the norm, really. I said, just probably like your parents, your grandparents have probably got property and land in India. It would be the same. So would they be delusional? And I just remember people in the room just laughing. I felt very strongly about that. I thought, how can you say she's delusional because she's telling you she's got property and a house in Jamaica and land? That's normal.
It's an interesting one as well, Don. Being originally Kenyan as well, even if a lot of Kenyans, I know that when they do come to the UK, will always invest back home. And so that again is quite the norm as well. Like they'll have something they've invested in back home, whether it's property. Again, it's always property, land usually. And so again, I can totally understand where you're coming from, where that would be seen as a delusion. Where why make that assumption? Why automatically make that assumption? Would you make that if I was, from Poland, for example, or anywhere else, that's European? Would you make that I must be delusional because I own property in another European country? European. So I can understand that must be quite an annoyance, to say the least.
Yeah.
The other thing I wanted to touch on was with your experience in mental health and working within the Afro-Caribbean community, do you find that, because I know for a fact that, I say I know for a fact based on my experience as a Black person, having lived in the UK for quite a long time, and having seen friends and family that have gone through mental health issues and the stigma that it carries in our society as Black people. From your experience, what can you share with the audience that would help our people start opening up more and start getting rid of the stigma and not waiting until they're in a complete breakdown, being sanctioned and going for counseling or therapy before they get to that stage? And how can we work together to get rid of the stigmas that our culture brings? Because as you're saying, whether you're a Caribbean or African or, Black American, I feel like amongst Black people, there's a cultural stigma around mental health issues. And I can't explain where it comes from. I can't explain it. Maybe it's this need to be strong, and constantly, just toughen up, or, and we're taught this as men, taught this as girls and boys, actually, from a young age. But how do you think we can work as a society to work better on seeking out help sooner rather than later?
I think it starts with the family, definitely, because a lot of times people will exhibit symptoms that appear to be, bizarre or unwell. And sometimes the family kind of dismiss it. I think, oh, they'll be okay. And it gets to the point, or we don't want to challenge that person, kind of thing, because we don't want to fall out with them. And it gets to the point where that person becomes so unwell and they can't get them to see the GP. And then they may phone mental health services and they'll probably say, well, the person needs to consent to, to an assessment, because most of the services that we have are opt-in services. So that person has to opt in to say, yeah, I'm happy to see a mental health nurse or a doctor. But a lot of the time, that's not the case. And they're at the point where they don't want to see anybody. So the family left in this dilemma, they want to see the doctor. And sometimes the doctors won't come out to see them at home either, really, which they should do. If a family member's calling the doctor, asking for them to come and see a family member who they believe is unwell, the doctor's got a duty of care for that patient, which a lot of people don't understand. Like say if you've got an elderly mom and you call the doctor and say, oh, my mom's not well, they're probably more likely to come out. But when you say, the mental health crisis, they'll say, oh, take them up to A&E. But it's not that easy if your family members doesn't acknowledge they are unwell or needs help. So and then they say, and the next advice would be, oh, well, if they kind of, become aggressive, call the police. And that's the next stage, call the police. So it's very unhelpful, really. The GPs really should be the first point of call, really. They should be coming to see that person at home and then making them referral to mental health services, perhaps even for assessment under the Mental Health Act. It's escalating, because a lot of time it does escalate. It gets to the point where family members can't cope anymore and the police end up being called. And that person's been taken out of the home environment, perhaps under arrest, or if done on the streets under Section 136, and then it just escalates, kind of thing. But I think a lot of the issues that people have as well, how can I put this? Nowadays you find a lot of people have like anxiety, or perhaps they've lost a job, or they've got financial worries or some kind of stress, and everything now is kind of medicalized. Whereas years ago, we're told just get on with it, kind of thing. So everything now you find, and doctors are quick to dish out tablets, or take this tablet, you'll feel better. But a lot of time, medication is not the answer for everybody, really.
No.
You know, it's about reaching out to some kind of therapy, some kind of service that can help that person. You know, even just talking to somebody, you know, like that's a good release. And then, which is why I got into coaching, because obviously in my role, we're kind of limited to what we can do in my role, because we work to a medical model, if that makes sense. So it's all about medication and that. Whereas in coaching, it's more about getting the person to find the answers to their own problems through questioning and using NLP techniques. Whereas obviously my role as a nurse is very limited. We don't do that, which is why I've kind of gone towards more coaching now.
I love that.
So I find it's very helpful. It's very helpful. Yeah.
I love what you're bringing here, Dawn. And I remember the first time we spoke, actually, we were saying with Anne how, you know, there's a lot of optimism that comes out from talking with you, and peace, and you know, you doing a job that is extremely difficult, and I don't think we can even understand it, because we've never lived it. But you know, working in hospitals, and you know, we were talking about it last time, you know, how do you deal with the racism that you may have faced in hospitals, and that you may have seen in hospitals? How have you dealt with that? And I mean, the concept, when I see you want to become a coach, and you're a coach now, you've been a coach since 2018, so clearly, you know, there's still this, that, you know, you're able to kind of make the difference between the person and the behavior. But you know, it is difficult after so many years of that. I just want to hear how you've overcome, you know, racism in your workplace, and maybe abuse that you may have faced from it.
I think there definitely is racism in the workplace. I'm not going to deny there isn't. There is. A lot of it for me is ignorance. I think a lot of people would like to tar all Black people with the same brush, which is not the case. Because I know I've got a lot of Black colleagues who are very passionate about their job, very professional. Especially being a female, you get labelled, you know, the angry Black female, which is not very helpful. I mean, I've encountered a lot of racism from colleagues, from management, from the whole system, really. And I've seen other people, colleagues of mine, experience the same. You know, you do the right thing, you raise it, you put in a grievance, and nothing ever really happens, kind of thing. So you do get a bit disheartened with it. But I feel, because I've got this coaching background, and that kind of helps me deal with a lot of things now. Obviously, not a lot of people haven't got that background, but that does help me. I mean, I don't know what the answer is for the racism. I think a lot of it's to do with ignorance. I mean, will it ever go away? Who knows? You know, if it's a long-lasting, stemming issue, you know, it's in all environments, in all industries. It's everywhere, really, which is a shame. I mean, even just now looking at this crisis going on in the Ukraine, when you look at the Black and brown people who aren't being allowed to leave the Ukraine. So, you know, it's really frustrating, actually, you know, because how I see it, I'm an advocate for equality. I believe we all should be treated the same. You know, I don't want any preference treatment because I'm Black. I'm treated the same as everybody else. And I think we should all strive for that, really. But that's not always the case.
I think it's so true as well. Like, I can feel the passion in when you're talking about a couple of things, actually, that struck out for me. And having worked in NHS as well, and I've seen it with friends, I've seen it with myself, where your pain is always undermined as a Black woman. And it happens so often, there's no denying it. I mean, there's several reports that have been, you know, published around how Black women's pain in NHS or in, you know, general medical settings is undermined. So that, again, is another form of racism. And then working there as from a patient perspective, and then working there as an employee, I was just thinking about the double-edged sword. if you report the racism and nothing happens, it feels like a double-edged sword, because you are then again being punished in a way, indirectly, for speaking out, because it's like, even if you speak out, we really don't care. Like, we say X, Y, and Z to offend you, and even if you spoke out and stood up for yourself, we're just going to show you once again, we still don't care about you. So you're damned if you do, you're damned if you don't. And it's just extremely frustrating that we're seeing this in certain industries, like the healthcare, where people are meant to be there and would hopefully be there to care for other people, because they generally like to help other people and be of service to other people. Going back to the Ukraine thing as well, it's just, you talk about, is racism ever go? Personally, I don't think so, because I think people will always find a way to hate each other, unfortunately, whether it's because of race or whatever differences. I think people, unfortunately, will always find a way to hate other people, because the Ukraine thing as well, just, it shocks me that even in a time so desperate as life and death and war, you still have the time and the heart to discriminate against other people. It is a bit of a sad dumper, but it is the reality.
It is.
So we're not going to pretend it's all roses and daisies and everything will be solved, with some kumbaya song. I think it's more about, raising awareness. And also, and I know this is something we've talked about with Tanya, sometimes we just have to focus on the ones that do actually want to change, rather than kind of talking to a wall that's not interested in hearing anything you have to say. I'm just looking at the time as well, and I know we had a lot of other things that we wanted to cover, but it's been so fascinating getting into all these different conversations, and I think it's been really helpful and useful as well for audience to get into a bit more depth and detail about what we've spoken about, and hopefully it does serve to help other people that are listening into the show as well, whatever point they're listening in as well. Just before you go, would love to hear more about anyone that you would recommend, or books that you'd recommend for the audience, just in spirit of educating and inspiring other people around diversity and inclusion.
Okay, I can't think of any diversity books off the top of my head, but one book that stood out for me in the beginning of my journey, I call it my self-development, my evolvement journey, because I do believe, we should be working on ourselves all the time to be the better version of ourselves. The book that did it for me was Stephen Covey, The 7 Habits of Highly Effective People. I think that's a good starting place to start. Because I think before you can make change anywhere else, you need to make that change within yourself first. Yeah. So I think it starts with you first. So definitely, that's one book I would highly recommend.
Absolutely love that.
Yeah, it's a great book.
Yeah, really, really a fantastic book to start. Even I think in the coaching journey, it's very much linked as well to, you can use it for yourself, but you can use it also a lot with your clients. So it's a great book I go back to quite often. Thank you so much, Dawn. And how can people connect with you should they want to connect with you? Is LinkedIn the best way?
I'm on LinkedIn. I haven't got a website as yet, which I'm working on. My email is dorver2003@icloud.com. So that's Delta Alpha Whiskey Victor Echo Romeo. I work for the police, can't you? 2003@icloud.com. I'm on Facebook, LinkedIn. Yeah.
Amazing. That's how we actually got in touch with you, and got lucky enough that you agreed to do this interview with us today. Thank you so much, and thank you everyone for listening. Don't hesitate to connect with Dawn and check her evolution in the coaching as well, the coaching space, coaching world. And we will be also posting other interviews, so check us out on our website, check the other interviews, purplecoachconversation.com. Thank you very much, and have a good day, everyone.
Thank you very much for having me.
Thank you, everyone. Bye.
Thank you.